What is the thyroid gland? The thyroid gland is a butterfly-shaped gland that consists of two side lobes connected by a bridge called the isthmus. If the thyroid is at a normal size, the surface of its structure should not be capable of being touched. The thyroid is located at the base of the neck, just below the Adam's apple, towards the front of the neck. The main purpose of the thyroid gland is to produce thyroid hormones for the body that aid in metabolism, growth and development, and body temperature. During infancy, the thyroid hormones are necessary for brain development. The thyroid gland is crucial for voice quality as well. Many nerve cells will pass through the thyroid gland to aid in voice quality. Doctors who specialize in the endocrine system are called endocrinologists. Their job associates with the thyroid gland and many other glands that secrete hormones to the body. Because the thyroid gland secretes thyroid hormone to the body, it is part of the endocrine system. However, many endocrinologists study thyroid hormone because of its relation to height, weight, and temperature in people. It is the most common thyroid cancer, taking up about 80% of all cases regarding thyroid cancer. It is constantly growing in incidence in the U.S. with more than 20,000 cases a year. However, the mortality rate is very low. Most patients have a good prognosis. The diagnosis of papillary thyroid cancer is poorly understood. However, many oncologists believe it can be hereditary and it can come from too much radiation exposure. Papillary thyroid cancer also tends to be more common with women than men. In the last year, it was the 8th most common cancer with all women and the most common cancer for women under the age of 25. Papillary thyroid carcinoma is caused by cancerous cells that defect checkpoints before mitosis that our body puts in place for defense. These checkpoints all occur over 90% of the cell's lifespan in a state called interphase, and they consist of G1 phase, S phase, and G2 phase. First, in G1 phase, the cell membrane grows physically larger, copies organelles, and synthesizes the mRNA and other building blocks necessary in S phase. If the cell does not have a sufficient amount of nutrients, it will be arrested. Second, in S phase, the cell will synthesize a duplicate copy of its DNA within the nucleus, and it will duplicate an organizing structure called the centrosome. In S phase, the double-stranded DNA is separated by an enzyme called DNA helicase. Then each strand receives a new partner strand from an enzyme called DNA polymerase. This adds the appropriate nucleotides necessary for a new partner strand. The result is two identical double-stranded DNA strands. Lastly, in G2 phase, the cell will rapidly produce more organelles and proteins to prepare for the upcoming M phase. The G2 phase also consists of a DNA damage checkpoint that will arrest the cell if it has signs of genotoxic stress. Genotoxic stress derives from UV radiation, oxidative stress, or DNA intergalactic agents. All molecular problems that fall under genotoxic stress can cause lots of damage if the cell has reached mitosis while containing genotoxic stress signals. So when a cancerous cell reaches mitosis, you can predict that it too will cause lots of damage. This is because cancerous cells can cause uncontrollable mitosis, resulting in rapid cell growth. Here are some symptoms of papillary thyroid cancer. Most papillary thyroid cancers are asymptomatic, or in other words, they do not cause symptoms. However, sometimes a palpable mass or even a visible mass can be detected, but this all depends on the patient. Tumors that are related to papillary thyroid cancer tend to be firm and consistently growing. Compressive symptoms may also result, which includes trouble swallowing or breathing. Because of these symptoms, oftentimes people diagnosed with papillary thyroid cancer will have a thyroidectomy. Thyroidectomy is a procedure in which a surgery takes place to extract the thyroid gland out of the body. This procedure is done when a biopsy has proven a nodule to be malignant. Although the science community is aware of the thyroid gland's importance to our bodies, the thyroid gland produces thyroid hormones that aid our body. It does this by absorbing a nutrient from the many foods you eat. This nutrient in our food is called iodine. It can be found in foods like fish, shrimp, cheese, and many other foods. After absorbing iodine, the body will do a series of molecular processes to produce thyroid hormones. These processes are complex, and in short, it will combine the amino acid named tyrosine with iodine to produce tridothyronine and thyroxine. The molecular processes of forming thyroid hormones is a team effort because it involves other bodily systems, such as the pituitary gland and part of your brain called the hypothalamus. The pituitary gland will be stimulated by the hypothalamus's thyroid-releasing hormone to produce thyroid-stimulating hormone for the thyroid gland. The thyroid-stimulating hormone from the pituitary gland will stimulate all the processes used to produce the thyroid hormones in the thyroid gland. As said previously, these thyroid hormones produced will aid in growth and development, metabolism, and body temperature. Therefore, getting rid of the thyroid gland will be detrimental to the body, because there will be an absence of the thyroid hormone. The most prominent problem from the thyroidectomy when treating papillary thyroid cancer will be the effect on metabolism. Metabolism will slow down dramatically, and the loss of the thyroid hormone from metabolism will cause symptoms of unexplained weight gain, infertility, slow growth, heart problems, nerve injury, and in severe cases, death. Therefore, a thyroidectomy is probably not the best option. Other contemporary treatments such as ethanol ablation can provide a more accurate, highly effective, easy to administer, and most importantly, safer approach. Ethanol ablation is simply the injection of ethanol into the malignant nodule, killing it. It only requires a CT scan used to direct the needle, ethanol to kill the cancerous cells, and a needle for the injection of ethanol. In conclusion, a thyroidectomy can cause detrimental effects on a person's body, and it may be more dangerous than the papillary thyroid cancer itself. Therefore, alternative methods of treatment such as ethanol ablation should be explored and used more frequently. As scientists, I believe it is our duty to find new ways to improve medical advancement in order to improve others' lives. Here are my citations.